goes to King.
Good evening, everyone, and welcome to another episode of This is Revolution Podcast. I am your host, Jason Miles, and yes, to start the show, you heard holiday music because it is the holiday season. And here at This is Revolution Podcast, Pascal and I, we were taking a request to replay past shows. We wanted to take a break. Gene Bajlan just had a kid. He had added to the Bajlan clan. Cuba is back and forth in various places throughout the world that we can't say since he works for the deep state. And we fought kind of internally, and we said, no, we'll just pre-record a bunch of shows. And when we were going to pre-record like 2 shows, turn into 3 shows, turn into 6 shows. And I don't know if I've mentioned this, the ink is dry on our deal with the Real News Network. And tomorrow we are recording our first show for the Real News, one of 4 that we'll be doing over 4 months. And it'll be with Adolph Reed. We will be discussing him and Tere's new piece, the Socialist Register, about gentrification. That's what will be, but that won't be live streamed. We do have to send them the finished product and get full details. But that's what's going on with that. Pascal, unfortunately, again, could not be here tonight. He was double booked. Calling him out. Motherfucker. Booked shit on show night. How dare he? What kind of a co-host is that? Ed McMahon would never do that. But it doesn't matter because I have 2 great guests that are professionals for this podcast show. But before we bring them on, I want to play a clip about what we're going to be talking about tonight. We're talking about 2 things: the savagery of the United States privatized healthcare system and the inconsistency of the Saw movie franchise.
Hello, this is Hillary Clinton. I want to thank you for letting me speak with you about an issue that is central to our children's future and critical in our fight to restore this nation's economy, solving our nation's health care crisis.
But my requests for coverage have all been turned down. So I was hoping that if I came and explained it to you that you might be able to get that overturned for me.
Well, the buck stopped here, John. Fire away.
The question of healthcare in the United States has been one of the preeminent questions in American politics. While some form of socialized healthcare exists in most countries, the United States is almost unique in the way that it leaves such life and death issues to market forces. In 2010, the passage of the Affordable Care Act, so-called Obamacare, was supposed to solve the healthcare question. However, unfortunately for millions, the profit-driven nature of healthcare provision remained in place. This week on This is Revolution, we speak with Dr. Eric Osgood about the brutality of the U.S. healthcare system and discuss with Qualia Redux her recent video that drew parallels between American healthcare provision and the Saw movie franchise. This is Revolution.
Policy has changed, Mr. Archibald.
Changed what?
Yeah, we've recently switched carriers from a PPO to an HMO. It's a less expensive policy, but unfortunately there are some restrictions.
What kind of restrictions?
Here's how it works. Non-management part-time employees, such as yourself, only qualify for second-tier catastrophic coverage.
No, I'm not part-time. I'm full-time. It's just slower.
Sure. but your coverage is based on hours worked, and like I said, you only qualify for second tier.
You got an HMO, right?
Yeah.
Well, there's your answer. I mean, HMOs pay their doctors not to test. That's their way of keeping costs down. All right, let's say Mike didn't need additional testing, and insurance says they won't cover them. The doctor keeps his mouth shut, and come Christmas, the HMO sends the doctor a fat-ass bonus check.
Is that true? Possible. Not likely, but possible.
You telling me that these doctors may have known what was wrong with my son and they could have treated him all along?
Who knows? I don't know.
Medical, something like that.
You got it perfectly. That's it.
It's funny, but it's not that far from the truth, okay? And this shit happens all the time. Paramedics bring in some accident victim, and when the big boys in accounting find out they can't pay, they send them packing.
Hospitals can't turn people away.
Isn't there laws against that?
Yeah, there's laws, but there's also ways around those laws. The only thing we have to do is stabilize them, and after that, we're off the hook, and you know it.
That's not how it works.
That's exactly how it works. Maybe not up there on the 5th floor, but in here, if you don't have any money, you get a Band-Aid, a foot in the ass, and you're out the door.
I'm back. One thing I love about that movie is John Q. I actually write on all the videos what movie it is, because in the comments, everybody always goes, "What's that? What is that? Where'd you get that from?" So I always write where it's from. Always. I always do that. Just so. Came out in 2002. I'm going to be getting kicked off a lot tonight because it's raining here in Rosarito and it has bad connection. But I love the movies where when they're talking about something like that, everybody interrupts, but at a specific time, like no one ever talks over anyone else. It's a hostage situation in that scene, but for some reason, everyone's really calm and can have this conversation about healthcare. I find that rather amusing. John Q. I don't know if I would necessarily recommend that movie. It's a little over the top with the message. But it made for great clips. Definitely a movie I watched in 2002. And maybe I teared up at the end. Maybe. But let's introduce our guest. Coming all the way live from New Jersey. He is now the famous doctor. You may have seen him on Dr. Drew's show. I want to say Love Lines, but it wasn't Love Lines. What was the name of the show? Is it like Dr. Drew telling you where not to stick it? I forget the name of his show. Getting Well. I'm Not Dr. Oz with Dr. Drew. Dr. Eric Osgood. What is that show called?
The one now?
Yeah.
Ask Dr. Drew.
Yeah.
I like your idea though. Don't where not to stick it. I think that's great.
Remember, Love Lines would be like a bunch of people like, so I was trying to fuck this pie. You're like, why were you doing that? It's gonna burn. Yeah, it burned, but yeah. So that was So also,
Adam Carolla went an unfortunate direction since that.
Adam, look, Adam Carolla always had these libertarian leanings, and he just seemed cool because he sometimes yelled at the right people. But the Man Show,
you
can't do the Man Show right now. Adam Carolla still wants to do the Man Show. He can't look back at that and be like, nah, it was a different time. He's like, oh no, you wokies are ruining me looking at boobs.
Even Stanhope would do the Man Show now.
Stanhope would not do the Man Show now. He'd be like, hey, it's a different time. At that time, I thought boobs were okay to look at and just jiggle. Now I know they actually belong to a person with a brain and a soul, and I shouldn't just try to exploit it.
Right. Not to be objectified.
Yes. And we will not be objectifying our next guest. poor person had to hear this whole talk about the man show. It was a show. It happened. Don't get mad at me. I didn't green light it. Didn't even watch it that much. She has her own YouTube channel, and she makes very interesting video essays. One I saw that inspired the show. I saw the video essay. The moment I saw the video essay, sent it to Eric. Am I lying? If I'm lying, I'm dying. I sent it to Eric. Then
No lie.
I requested followership, Twitter friendship, whatever you young people call it. I reached out. She reached back. She had no idea of the pre-intro boob talk that would happen before she came on the screen. But we're going to squash it now. Please welcome the muse for this show, Qualia Redux.
Hello. How are y'all?
I'm good. I'm good. How are you?
I'm great. I had to go to the dentist earlier today, but now I'm all fixed, so I'm here to talk to you.
Are you high?
I am not high. I'm just like this.
Okay. If I trust you, I check your pee later.
Yeah.
You sent me a hilarious message that said you didn't know they were going to numb your mouth.
I didn't. I thought. Let's see. We're doing a whole thing. Like I'm going on a whole medical journey, and something broke, and I was like, it'll just be a quick thing, and it was not. So we're all fixed. I'm happy to be here.
Now I saw your clip. Or a clip of your show on a much larger YouTuber. What's it called? ThoughtSlime.
Yes.
Linked to your clip. And has he since taken it down?
I don't think so. Did ThoughtSlime do that?
I hope not. I couldn't find it on his site, but of course, I went and subscribed to you right away once I saw it because I was like, this is a very interesting story. Can you briefly run us through it?
Sure.
Your tale of dealing with the healthcare industry.
Sure. Like, you want to hear about my birthday?
It was your birthday. That was my birthday. So on my birthday, I woke up. I had a really rough time that day. I had the previous day gone to the doctor with like horrible abdominal pain, and they thought it might be pancreatitis. It was like 50-50. So I had to go get my blood drawn, and I needed to get like a prescription filled, which is why I didn't do it the same day. So I went to the CVS to get like an anti-anxiety medication filled because I don't like blood draws, and drugs are great. And I found out like in the line at the CVS that this isn't covered, and it wasn't covered because my insurance had been canceled. I had like an ACA marketplace plan. And I found out the reason why that had happened was for some reason the withdrawal hadn't happened 2 months in a row, and I'd spent a lot of time battling with the bank and battling with the health insurance agency to get that money out of my account and to the insurance agency. And so I called them because I had expensive blood work that was going to happen that day, and I couldn't just pay like $1,000. And yeah, I couldn't get reinsured. And to this day, I don't have insurance. So that's great. And I didn't get the blood draw. And like I say, we thought I might have pancreatitis. So it was kind of scary to be like, well, if I die, I die. Well, and it was also compounded by the fact that your husband also was ill at the same time.
Yeah, my husband has migraines, and he has chronic fatigue syndrome, and he takes a lot of medications to sort of keep him going. So yeah, it's scary. And like I say, to this day, I do not have health insurance. I don't have dental insurance. So we're just kind of getting by.
And in it, you tell this tale as you're, trying to deal with all of your healthcare woes, that you went and watched the Saw
I went
movie.
Saw. Yeah, that night after my husband went to bed with a migraine, I put on Saw because I personally love Saw. I know you rewatched it today and did not love it, but I sort of, it's like a comfort movie for me, weirdly, because I find it sort of cathartic. I don't know.
And you're a fan of the Saw movies, Eric, right?
Yeah, definitely.
Eric, now what was your take when you watched the video of Qualia? What was your first response to that?
It hit home. It hit home not only from the side of like watching patients over the years go through just the torture chamber that is the U.S. healthcare system and trying to navigate it when you're sick, but also having a loved one that's had to navigate that system and seeing that person run into these kinds of obstacles and get bounced back and forth between different entities and basically hit brick walls and not be able to get what you need, run out of medicine, not be able to get the procedure that you need. It's horrific, and a lot of it is just basically red tape. These cracks that are basically not flaws of this system, they're part of the system design. The whole system's designed to just hoover vacuum cleaner money up to the top to the insurers and primarily to the pharmaceutical industry and to the insurers, and leave patients basically just scrambling trying to scrape together the money that's needed to make sure that the premiums are getting paid. And then of course you basically have to choose between a premium you can afford, but in that case you're going to probably have a high deductible, or shoveling out more money for a premium so you don't have that high deductible. If you have a deductible that's like $6,000 a year and you're like a worker making a typical set, you're functionally uninsured, because every single dollar of healthcare that you're putting out until you hit $6,000 is coming out of your pocket. So you're functionally uninsured. You might be nominally insured, but you're not covered in terms of the cost that you need to, especially if you require medications from month to month that are not cheap, or if you need particular procedures done, anything like that. I mean, in my case, I have psoriasis, and I have a plan that has a $70 copay for specialty visits, and I'm doing these laser treatments, and you got to do a couple of them a week, and you got to do that for a couple of months. I'm paying $70 2 times a week to go basically have somebody rub wave a laser over my skin, and I have to keep doing that for months. I'm in a position, fortunately, where I'm going to be okay with that. But if I were in a position where that money was going to be sort of, I did not have that kind of sparing, I would just have to deal with it, and I would not be able to get the treatment. And that's just psoriasis. That's largely a cosmetic condition, although it does have other ramifications. But there's people that have issues with whether it's blood pressure, whether it's debilitating pain, and they might need procedures to keep that under control. Things like ME/CFS, which it sounds like your husband Qualia has, or chronic fatigue, myalgia stuff. I mean, that's debilitating. By the way, you got to get him in touch with me, because we have an ME/CFS clinic, and I think I could probably help him.
Oh, that would be amazing. He sleeps like 12, 16 hours a day, and it's been hard for the past few years.
All right, DM me after this is over. We'll talk about it.
Wonderful, thank you.
And that's what we do here at TIR.
That's right.
Bring people together.
We actually just had a meeting right before we jumped on here.
But Qualia, you also spent some time working in the administrative side of, was it Medicaid, you said, right?
Yeah, I've seen a lot of sides of it. Like what I've done sort of in the medical industry is I've worked as a direct care worker, helping people with developmental disabilities and geriatric people take care of their daily needs. And then I worked my way up to administration from there, where I coordinated care between a team of doctors and other professionals, just to make sure that we were all on the same page. Because, if you have somebody who needs 6, 7, 8 doctors, you need them talking to each other. So that was my job, to get them talking. And then from there, I eventually got an accounting degree, and I started doing auditing and financial analysis, and I ended up doing the oversight for Medicare and Medicaid capitation rates, which is how they get paid through the states. Let's see, the insurance companies are only allowed to make a certain profit margin. Like, I think it's like, depending on their contract, it's usually about 5%. So if they make more than that profit margin, they need to pay back the state a certain amount of money. And but they also have like minimums where they can't make less than 2%. So I had to make sure that they were within those guidelines.
Interesting.
Which, I think it was interesting work, but when you're like an accountant, you think an nerdy like that is fun.
Well, and this gets more into your video, and as I was making the clip for the show, I was actually thinking about not even making a clip and kind of just playing your video, but it's just so goddamn long. No, I'm just
it's very long.
No, it wasn't too long. For what you do, it was the length was perfect. That didn't sound, you know what I mean. And and I couldn't cut because the story is so, the way you tell it, you really bring people in, and so to edit anything from that, I think would be taking away from the narrative that you spun.
Thank you very much. I appreciate it.
Yeah, I really enjoyed that too. That was, I mean, I can't tell you how much that hit home. I was like, when I found out you and I were going to be on the podcast together, I was like,
well, I really appreciate it, and thank you for having me. It's always great to get to talk to like comrades. It's so rare, like in my daily life, to get to meet other people who share my values. So it's just a pleasure.
Definitely.
Was I gone for a second?
I don't think you were. I saw you down there.
Okay. No. Thank you. No, again, thank you for coming on. I appreciate you guys doing this show tonight. I am kind of sorry that Pascal's not here. I know he definitely has some things to say about the healthcare system, as we're all kind of victims of it in some way, shape, or form. Another reason why I wanted to put that movie John Q on there is because it's kind of an interesting tale that it might not be hitting so much home today, because as there's a labor shortage, people are working more. But in that movie, his character is a blue collar worker that gets his hours cut. So he's just below full time. And because of that, his health care premium is changed to a different tier. So the movie, his son has a rare heart condition that's never tested for, and his son needs a transplant, and it costs some ungodly amount of money. He thinks he has coverage because he's had this gold plan for X amount of years. He's been paying into it the same amount for so many years, but because his hours were cut recently, they of course drop him down a tier. It doesn't get covered. He takes the hospital, or he takes the surgeon in the hospital hostage, and his son gets a heart. It has a kind of a Disney-esque ending, but that
happens like once a week at my hospital. So
happened at your hospital?
I'm just joking. No.
I was about to say
once a week.
Yeah.
Every time
like
Denzel Washington gets pissed off.
You get home. How was work, honey? Oh, it was another hostage situation, but it was Denzel, and he's a god. So it's always great when Denzel takes you hostage.
Denzel Washington can totally take a hospital hostage, and no one's gonna say
it. With his eyes. He doesn't even need a gun.
With his eyes.
But it's which Denzel do you get? Do you get Denzel from Glory? Do you get Denzel from Training Day? Like, who's taking
Training Day?
Ooh, everyone's gonna die.
Yeah,
you're gonna die. Training Day, Denzel.
Yeah. Yeah, no, just like and then again, just touching in on sort of, the word you use, savagery, is actually, I spent a lot of time reflecting on that too, because, being a hospital doctor, and especially being one in a place where there's an open intensive care unit, what I like about what I do is I see people when they are at their very most vulnerable and their most sort of fragile. They are in a state where if we don't make good decisions, that could mean, their life and the life of their family. And oftentimes they get discharged. That means they're stable enough not to need the hospital anymore. But, the battle is far from over. They've got multiple appointments to make. They might have specialists to see, outpatient testing to do that we just don't do in the hospital, following up their primary care physician, getting their, looking over the medicines, making sure they're tolerating anything we might have started. There's like a lot of steps. And just when you're relatively well and you're trying to navigate the healthcare system and deal with, reception to billing to this person to scheduling, and, my insurance doesn't cover this surgery center, I have to now schedule it at this one. And now I have to get on the phone and make sure the prior authorization went through, and all, like, trying to navigate that when you're well is actually like could feel like a full-time job. I just imagine when you're unwell, and I mean unwell to the point where you were in the hospital, potentially debilitatingly ill, and to have to navigate that system and be hit with these bills and have this financial constraint. It's just like, I can't think of anything more cruel to do to a person. And I mean, with you work for Medicare, so you probably know, someone might have Medicare A, Medicare B, and Medicare A pays for your inpatient stay, Medicare B is for your outpatient coverage. And depending on the type of your hospitalization, you might get put in under observation, you might get put under inpatient. Somebody gets put in the hospital under observation status, and they have, now your Medicare B pays for it. And if you don't have Medicare C or supplemental coverage, you end up getting a bill. I think Medicare B will cover only about 80%. And the other 20% you actually end up paying for out of pocket. And so if you get put in the hospital for a potential, they're ruling out a heart attack, stroke, you get in, you might have a stress test, cardiac catheterization, a couple of days you're out, you're talking thousands of dollars, and you had a bill now. So after everything you went through, now you got this huge bill, all these follow-ups, trying to figure out what's going on. And just like the notion that we have not, as a country, gotten our act together to realize that this is just an incredibly cruel thing to put anyone through just baffles me. Yeah, go ahead, please.
Oh yeah, and it's like complicated for me, and it was like literally my job, and I had like financial training and all that. It was literally my job to know all this, and I had to have like a cheat sheet. I had to get help from people to help me do it. It is so complex, and it's often super complex just to meet certain regulatory requirements, both from the Republicans and Democrats, Republicans who don't want the program to work, and Democrats who don't want the wrong kind of person to get benefits, which is nuts. There's sort of this moral element oftentimes to, to the whole thing that's really frustrating. And one thing that was always crazy to me was we had to deal with the insurance companies, and the insurance companies were not worried about us. They wanted their money. They wanted, if they did something wrong, they didn't mind, they didn't care, because anything that might delay them getting their money, they could just call a state congressperson and they'd get on our ass,
Mm-hmm.
There's just nothing politically standing against insurance companies except for, maybe the left, and we're fairly small.
Right. Yeah.
As my co-host says, we don't have a left in this country, we have leftists.
Mm-hmm.
Yes, exactly.
Yeah. And you mentioned this moral thing, and that just reminds me, one thing I just have to I have to let off steam about is this bill that's getting introduced apparently in Illinois, where they want to, the idea is anyone who has not gotten a COVID-19 vaccine, they want to make it so that their insurance can just deny all your coverage and hit you with the bill. And you have people who consider themselves to be on the left or liberal or whatever they want to call themselves, cheering this on as though this benefits anyone other than insurance companies, as though it's going to lead to anyone else getting vaccinated who isn't, and it's just not a matter of cruelty. And it's like, you either believe healthcare is a right or you don't. And
Yeah.
I mean, I don't like that people aren't vaccinated. I'm trying to do what I can to help, rectify that. But like, part of what I do is forensic internal medicine in the hospital. So I take care of inmates for a living. And so, I'm providing care to people who are convicted of murder, who are committed of, I have patients who are, convicted of sex crimes against minors, to, weapons trafficking, to, whatever else. And I don't really concern myself with whatever it is they're in for. They're my patient, I'm their doctor. And it's like the idea that I'm going to moralize someone for making a bad decision that I find frustrating, in the way that I think that's appropriate is I'll just hit them with a big bill and let insurance companies deny their care. That's such trash. I mean, like, one of the things I did today is I had a patient who was an inmate. I have no idea. For all I know, he killed a bunch of people. I don't know. And this person had a bad gout attack of the knee and was in agony. So I did a procedure where I put some medicine through a needle into the knee to alleviate that pain. Now, why did I do that? Because that's my job. And when a human being is suffering and I'm their doctor, I'm their healer, it's my job to take care of it. It's not my job to start digging into their background and figuring out, does this person morally deserve care or not? You either believe healthcare is a right and a universal and a human right, or you don't. And I've been very disappointed at some of the voices I've seen who clearly have demonstrated that they don't think that's a right, and that there are terms and conditions that apply. And again, such a thing would benefit no one except insurers. And it's just disappointing me that anybody would be going along with something like that.
Yeah, there's this incredible punishment culture around medicine, strangely, that is like, somebody doesn't get a vaccine, so we're going to stick them with $1 million bill for, being intubated, being in the ICU. We're going to stick their widow with that. Like, that's unbelievably cruel. And what does it teach anybody? It's just cruelty for the sake of cruelty.
That's it. Yeah. And probably at least 8, maybe 9 times out of 10, that person is somebody who was already a victim of like some kind of misinformation that they heard that caused them to make that decision. And now you're re-victimizing them by saying, okay, you made that crappy decision. Maybe, I'm not even going to say these people's names, but so-and-so, you watched the video where they spouted some nonsense and scared you and you didn't get the vaccine, and then you end up in the hospital on a ventilator. Let's double down and victimize you again by sticking you with a 6, maybe 7-figure bill. That'll teach you. It's like, who's that teaching anything? Who does this benefit? I'm just trying to understand, rather than give some dumb release to people who are just frustrated aimlessly. Like, yeah, serves them right, screw them. Like, I don't know. It's just really frustrating.
Like my mother-in-law, she has a home health aide for her father, and that home health aide was anti-vax, like straight up anti-vax. And instead of being like threatening her, the mother-in-law like sat her down and said, I would be so disappointed if my father died because he caught COVID from you. Like, I would be disappointed if that happened. And I'm also just worried for you and your health. Like, you're so young and there are so many side effects. So I'm not going to fire you, which I thought was very generous, but this person is like 21 and making like 8 something an hour. They weren't going to fire her. And after that heart to heart, she went and got the vaccine. Like, I think a lot of the time, like, I know that there are dyed-in-the-wool, like, people who want to be ignorant and like true believers in kind of a culty anti-vax thing, but sometimes it just takes being a human to people.
Yeah, that's very true. That's what I found.
It's also interesting to me on who gets to have that conversation about anti-vax. And there was I forget what the documentary was on, but they were talking about flu shots, and it juxtaposed the kind of stereotypical new agey anti-vaxxer in like Southern Oregon, white lady, not vaccinating her kids, everything's vegan and natural, to a family from, I think, Central America that was making the journey up to the States, or attempting to,
And I guess a lot of people perish because of getting sick, things like the flu. It's like a few thousand miles you're literally walking. So there's a clinic, I forget where in Mexico it is, and it's definitely run by missionaries, where they were giving out flu shots. And these people were so thankful to get flu shots because it was going to keep them alive in their journey. And I felt that way in working with the unhoused.
Mm-hmm.
You know, they never get to be a part of these conversations.
Yeah.
Because generally, you know, people think vaccine, they're never part of the discussion. For a hot minute, they were part of the COVID discussion early on, as the lockdown was starting, because people were asking the question. But because remember when it was like wash your hands and all that other stuff, it's like, well, what about the people that don't have access to hand washing now that you've closed public restrooms in California, gas stations? Like, what are you going to do about them? And it was on the ground activism that had been going on for some time that pushed the governor to do something, to, you know, open up the hotels and put people in the hotels to keep them safe.
Right.
Yeah.
Yeah.
But
that was a crucially important thing.
And even that, you know, kind of was a bailout to certain real estate interests. Nicer hotels definitely weren't involved. So where there's issues even that you can have with the Operation Room Key, I know neither one of you guys are in California, so it's probably not something that's real big on your radar, but I do think Room Key does set the groundwork to let people know that we can use these old hotels and motels to house our unhoused population. Single room occupancy is a great way to start. And it's public health. And we don't look at this as public health, and that's how we should look at it.
100%. When during the beginning of the pandemic, the undomiciled and the undocumented don't have any way to get things paid. Like, you know, we would get somebody to the point where maybe they only need like 2-3 liters a minute of oxygen. And if you have insurance and you have some finances and you have the means, you can go home like that, you know, and you can recover. And it might take you weeks before you can actually breathe room air. But if you are undomiciled or you are undocumented, if you're undomiciled but you're a documented citizen, we can sometimes do Medicaid pending and get you placed and get you resources. But for people who are undocumented, it was a big challenge because there's no way to get them any kind of resources paid for. And people were just sitting in the hospital, occupying a hospital bed for weeks and weeks and weeks, until finally their lungs got to the point where they could tolerate breathing room air without oxygen. And just think about like all the resources that eats up. People are stuck in isolation away from their families. And very simple solution would have been just what you said, having these, using hotels or whatever kind of resources to put people, that would have been great. But unfortunately, we didn't have anything like that. And that was just another example of like the cruelty that in the savagery of the healthcare system, where we don't have universal healthcare. We have people who are uninsured, again, in many cases with what we dealt with, undocumented, no way to get any kind of coverage. And they finally get released from the hospital with no adequate way to follow up. They're often left with lingering symptoms and often debilitating symptoms. And they're trying to deal with this at home with no home health aid, no home services, no nothing. When it's like, if you believe that this is an actual right, it's a painful thing to think about, watching people go through that up close. And that's it does make you think of a Saw movie when you watch it. It's not all that dissimilar.
Yeah, I mean, Saw definitely. Yeah.
Go ahead, Qualia. I'm sorry. Go ahead.
Oh no, I Saw definitely, like, it's not one of those well-made movies that has like an intentional message, but it's definitely has some commentary on how systems can be used. It definitely, the games that are played in Saw are definitely used as metaphors for these systems that catch you between impossible situations and all that.
Mm-hmm. Yeah.
Yeah, but
it's not a good, it's not well made. Like, I'm gonna sit here and say,
you know what? Let's just not even get on the well-madeness of it, because I
okay,
think the effects work. I think the acting is there. I have no
Tobin
issue.
Bell is awesome.
Tobin Bell is awesome.
He's
Tobin
great.
Bell is awesome. You know, I definitely have some issues with some guy that's got cancer that's walking around with some sort of Wolverine shit and is on slicing up Danny Glover and beating the shit out of everybody and running out of. I'm like, God damn, what kind of chemo did you have, Saw guy?
Yeah.
Fuck me.
Yeah,
Fair enough.
You're running around here like goddamn Rocky Marciano in this boxing outfit, tortured the shit out of everybody. You just beat
got a
the
little
shit out of
soul
Danny
patch.
Glover, who is in great shape, mind you. At the time,
right.
I ran into Danny Glover once at an event, and my first thought was, damn, you're taller than I thought. And then my second thought was, this motherfucker's in good shape to be like 105.
He's a great leftist, Danny Glover. He was a big Bernie guy. Oh yeah.
He is on our list of people to interview, because now that we're doing the real news, we have access to quote unquote big names. So we made a really ridiculous wish people that to.
Congrats. Oh my God. That
Only
sounds great. Like,
congratulate
why are
us.
you slumming it with me?
Look, I only want to talk to people that are interesting. And again, your video moved me, and I want to get back to your video because it is very moving, because you paint a portrait of not just yourself and your own annoyances with the system, but you're the reason why I call this the savagery of the U.S. healthcare system. Because one thing I think the Saw movies does miss is an attack on a system, and it's more of an attack on people.
It is.
Much
it's
like
definitely
John's
regressive.
It's not an attack on the system. It's not an attack on capitalism. I don't even think they say private healthcare in either movie.
Yeah.
I don't think
For
they say
sure.
capitalism in either movie. And we can have a whole other conversation if you guys want to about how the romanticism of anti-capitalism, which is extremely popular now, is part of capitalism.
Oh.
It is not coincidental that Squid Games and Parasite, Joker are extremely popular, award-winning even. And it's not like anyone's worried.
That's true. Like, I don't think any of them offer, like, Squid Game is a great critique, but it doesn't suggest anything really.
Snowpiercer,
Mm-hmm.
another one that got turned into a series, so successful on the streaming platforms that it got greenlit for a series, which is a over-the-top, hit you in the head critique of capitalism.
I think with Saw, though, less than a systemic critique, it really is like an individual passing the buck critique, right? Like every individual involved, like you could have done something differently and you chose to just go along. And so it's almost like hey, the system, man, like, no, you and you and you made these individual choices that you're now paying for. And I think that's kind of maybe a critique to the sort of like the aimless, we hate capitalism, as opposed to like movement, organizing, activism, and actually doing things. It's more of that sort of individual critique about the choices that people make, and just kind of taking the easy road, and as opposed to, doing what's right.
Like, I wouldn't even call it that coherent, because on the one hand, it's a serial killer. He's not got a legitimate critique of anything. He's the bad guy. But at the same time, they really kind of valorize. Like, they're sort of like talking out one side of their mouth, and then on the other side, but isn't he cool? But isn't Jigsaw kind of cool?
Yeah.
So they never really land on a coherent ideology, I would say. It's very conflicted.
And his victims become, you know, his minions.
Yeah, a lot of them. Like spoilers, but like I think even Dr. Gordon becomes one later in the series. His
I only
first
watched up
big
to 3.
victim.
After 3, I was
That's
like, I get it. I
yeah,
get it. You're
yeah,
gonna do
no, you
people.
don't need to do that. Yeah, you don't need to hurt yourself like that to keep going.
I used to
Yeah,
watch
all that-
the show. Sorry, go ahead.
Say again. Watch the show.
I used to watch the show Becker back in the day, so I liked Shawnee Smith, and so I liked her character too, and how she became like the.
I mean, they
That
made They made 9 movies.
They did.
Yeah.
I haven't seen the most recent one. Like
Me
I was
neither.
like I wanted it to be good, and then I heard it wasn't, and then my heart broke a little bit. But yeah, I
Chris Rock
was
was in
rooting
it?
for it. Yeah, Chris Rock and Samuel L. Jackson. I was like, I was like hoping that it was like, okay, some horror fans, a different take on it. I'm into it, and then I heard it was not good, and I was like, oh.
I mean, look, watch it. I'm a big like watch it anyway. Fuck what I say kind of guy. Like, don't.
It's true.
I'm never gonna tell you like don't watch something because I didn't like it, because there's a lot of shit that I don't like and like that people don't like. So fuck what I say. But I haven't watched. I almost watched it, but I was like, no, I'm gonna go watch the original because the original kind of lays the groundwork. Qualia said she watched the original, so let me go rewatch the original. And rewatching the original, I was kind of like, man, fuck this guy.
He's a bad dude. Have you heard this? You heard that this Saw guy is bad? Jigsaw?
Yeah.
Man.
Like in real life?
No, well, yes. I don't know. I think every serial killer is probably a bad guy in real life.
Oh, yeah. Like,
no.
So I had
not something else wonderful.
I had done a show earlier in the morning with Dr. Ashley Frawley, like really early in the morning, and we were, she was the one that actually brought up that point about romanticizing anti-capitalism that really stuck in my head as we were talking about some of these movies. And I knew I was getting ready to see Saw after I talked to her, and it did kind of color the way I viewed the movie again. I never really had that much of a problem with it when I was younger. I just get tired of seeing people die in fucked up ways like that. You have a choice. No, I don't. You didn't give. No, I don't. These choices suck. And I felt like it didn't really attack the system. And there's a lot of these movies that don't necessarily attack the system, and they attack the individuals. Again, like John Q, which I haven't seen a movie, maybe Dr. Eric knows of one that's come out to be that critical of the healthcare industry. And this is before, this is what, 2000, this is what, 6-7 years before we were even talking about the ACA.
Yeah. You know what movie you should check out? It's older, but it's called Critical Care. James Spader and Kira Sedgwick, and I think it was from like the early 90s, and it was pre like the 1997 Balanced Budget Act. So this is back during the time of like the catastrophic coverage. Everything was fee for service. Doctors would like go onto wards where people were like basically vegetables, and they would do all kinds of procedures and surgeries and cardiac casts, things that they didn't need because everything was just fee. By the way, the doctors doing that are the ones that stuck us with what we have now. They just put their hands in the cookie jar and they milk the system. And
tell us more about this, Eric.
Yeah,
drop the bomb. Come on, inside dope. I'm about to blow you up. Give us the inside dope.
Yeah, no, I mean, like if you had catastrophic coverage, it was just like a free for all. And so, I mean, now you get paid in a diagnostic, basically for DRG. So for particular diagnosis or set of diagnoses, you get a fixed amount of money or a fixed bundle payment. And it doesn't matter if you're in the hospital for 1, 2, 3, 4, 5, 6, 7 days. That's it. So if the good side of that is it sort of drives a little bit more careful resource utilization. You're not doing a bunch of unnecessary things, so you're not going to get paid for them. The problem is then the problem that John Q had is like, oh well, the doctors get paid not to do things. That's a little bit of an exaggeration, but in a way, you're basically de-incentivizing unnecessary things from being done. So it's like it's a balance. But before that, everything was fee for service. So You do this procedure, bam, you get paid for it. You do this procedure, you do that test, you get paid for it. Versus now, they're a lot more, they clamp down a lot more, and things will get denied, and or simply they will just go beyond whatever the fixed payment was for that hospitalization or that diagnosis related group. But this movie was made back during those times, and so it's about this, like, I think he's like a senior, like medical resident in the ICU, and it's just like, it just sort of chronicles his experience taking care of these different people. One of them is basically just like an uninsured guy who just destroyed his liver with alcohol, and now he's at the end of his life. Another guy is like a rich old man who's basically in a vegetative state, and he's got these two daughters who are like vying for his inheritance, and he starts sleeping with one of them. And he's got like the chair to the apartment, like won't let, like anytime someone comes in, like a trauma or an accident or something like that, well, what kind of insurance do they have? And if they didn't have good insurance, it would be like, give them the bare minimum, and they would have to like game the system to get them to agree to like allocate resources to people based on what kind of insurance they had. And I've never really seen a movie that tackled the healthcare industry pre everything we have now. Like what we have now is like healthcare 2.0. This was healthcare 1.0, which a lot of people forget about and we don't really talk about much anymore, but how like messed up things were back then. And now we're in the stage where it's all about the thing now is like it's a game where your clinicians, your doctors, nurses, and hospitals are, everything is around documentation and making a chart that looks as good as it can and makes every case look about as complicated as you can make it look, to try to justify the most possible billing you can do. And what really sucks about that for the patient is that you want your clinician, whether it's your doctor, your nurse, whoever it is, to be like looking you in the eye and paying attention to you and making really a human healing connection with you. And instead, they got their noses buried in computer systems, because everything that they do, your entire job, livelihood, and the way that you keep the lights on in the building is through documentation. And so, you guys have probably seen, you go into a doctor's office, you might remember, I think we talked about this last time, you probably remember a time when you were younger, you would see your doctor and you would feel like this person was like made a human connection with you, and they paid attention to you and put their hand on you, and you had that real human connection. And now you probably realize that when you go to see your doctor, they just got their nose buried in a computer screen and they're typing and like asking you boilerplate questions and just typing, and maybe for a brief period of time like examining you, and then it's like right back to the computer. Unfortunately, the way that it works now, because we're stuck between trying to bring as many people into the fold as we can through the ACA, but not actually covering everybody, still keeping for-profit health insurance in play. We basically have this system where everything is just dedicated to documentation. And so we have electronic health systems that their job is to make money and their job is to provide a service for the hospitals. And so they design systems that are basically designed to keep clinicians busy clicking boxes and typing things into little templates, because what does that do? It produces documents that generate the most money. So the system is now still all centered around money, but it's done with completely different incentives to sort of keep the doctor's hands out of the cookie jar, but the insurers still want to get their cut, and the hospitals still want to be able to bill for as much money as they can, and they still want to be able to pay for as little bit of service they can and get away without paying for whatever they can. And so now this is like the next phase of healthcare that has really sort of detached doctor from patient, and everything is built in around just documents and documentation. And Qualia, you probably have some experience with that too, having worked in sort of that side of the healthcare arena, where they just basically pour through anything they can find in charting and documentation to justify not paying for things. And so it's this constant like cat and mouse game between like trying to deny coverage. But when you're a patient, what do? Anytime you go to a practice or a doctor's office, wherever, you're signing a piece of paper saying what? No matter what happens, you're ultimately responsible for that bill. So if it doesn't get covered, that could be because the doctor's office effed up and didn't put the code in right. It could have been because the insurance company is screwing around with you and not paying when they should. You are ultimately stuck with that bill. And if you don't pay it, there's no dispute. They send it to collections, and there's absolutely nothing you can do about it. And so it's interesting how all the things that were designed to fix the bad things that were used to be done in the past have really just kind of brought us full circle, where the same system happened, the same symptoms happen, it's just in a very different way. I really hope this was more coherent than it's sounding in my own head.
No,
but,
your passionate rant is felt on everyone. The chat is starting to kind of blow up a little bit. I want to shift to Qualia because she ends her very, very, very powerful video essay. She ends it with a parable about how we should view these medical bankruptcies as not just numbers on a sheet of paper, but the human aspect of them. Would you mind giving us that doing that?
Sure.
Giving us that narrative,
Sure.
again, Qualia?
Like, I think I said that, I want you to imagine like an old guy with cancer who's having to pay for chemotherapy, and, half of people get cancer, like 50% of people get cancer. And I think most people with cancer go bankrupt within 2 years because it can cost $1 million. And every medical bankruptcy represents somebody who doesn't get to retire the way they wanted to, who doesn't get to get taken care of in their old age the way they wanted to. And instead of seeing this as like, gee, this is such a shame on that, an accidental shame, this is very intentional. This is, first of all, a way for us to sort of bank capital so that capitalists can suck it out in our later years. And it also means that somebody who is elderly is going to have to go work as a Walmart greeter instead of retiring. And they're going to have to work for pennies when otherwise they might have chosen to retire or work for more money. When we're sick, when we're kept sick, we work for less money and we complain less about working for less money because we're scared. And it's horrible, and it's exploitative. And even if you're disabled, like there's rarely a way out. Like my husband applied for disability and he did not get it, and he is profoundly disabled. So there's rarely an alternative to incredibly exploitative work. And something's got to change. Like I hope it's going to change soon. I don't know what would cause that, but it needs to change.
You would think it'd be a pandemic. Speaking of a
so.
pandemic,
hey,
Pascal's going to inject you with the virus.
Everyone, sorry I could not be here earlier. I had to speak at a function. I was invited to talk about Haitian politics and affairs that were going on in Belmont, Massachusetts, for a relative of a friend of the show, who was actually a fan of the show. So I was dispatched to appear on her Zoom panel. So
Great.
I apologize for not being available for all of the multiple of hard-hitting questions that I know that my host.
No, not really. It's more of a conversation. It's more of a hang today.
Yeah.
More of a hang. But because Pascal is here, everybody, I do want to say this. Usually we go right now, we cut the show, and we say, all right, the rest of it is behind a paywall. But because paywalls are kind of sort of what we're talking about today, let's just keep going. We got Robert here for a little bit. Pascal, we're talking about healthcare. What say you?
There's a lot to talk about healthcare.
Well, then, go on, brother.
First question is, why is it that during an age of a global pandemic, where the country that seems to be the best handling of the COVID issue, which was Sweden, that has universal health care, does not create the necessary political climate where progressives or leftists can make the argument logically that universal health care is needed.
So great question. I would respectfully dispute the claim about Sweden. When you actually compare that to other Nordic countries, Sweden actually made a few goof ups as far as their response and not doing some of the shutdowns, masks, and things like that. Although when you compare Sweden to most non-Nordic or non-nations, so non-Nordic, Scandinavian, I don't know what the right term is,
The
but
non-blondes.
yeah, exactly. Because there's these are two very different populations, but yeah, they did have a much better response than a lot of other countries. What people don't realize about the U.S. is, despite the fact that we don't have universal health care, we were actually the GHSI, the Global Health Security Index. We were actually one of the highest in the world to actually handle the pandemic. Exactly. The only aspect where we fell short, and we were way down compared to the other like OECD nations, was public trust in like public institutions. So, and we've seen how that plays out. We've seen how already from at a baseline, the public just is distrustful of institutions, and we've seen between like the different gaffes that have been made by the CDC, the FDA. We saw a completely incompetent Trump administration, and now a neoliberal Biden administration that's really just kind of piecemeal improving, but not much. And people's trust is even further eroded, and that's been problematic on both sides. And now you have this reactionary right side that just doesn't trust in vaccines and thinks that they're trying to lie that masks are beneficial and everything's countered. And then you have another side that's very distrustful because they think the government's opening too early, and they're critical of the CDC for ending mask mandates too quickly. And there's just no trust in public institutions. Versus in other countries, they don't quite have that problem. And then, of course, yeah, we have a ton of cracks that people can fall into. But we were just talking about before he came, where you can fall into a crack and you can end up with these massive medical debts. And it can happen to any one of us, even if you are fairly well insured. And I think that there's a very small group of entities that are making money hand over fist because of the current system. They have a ton of power. They control, they have a ton of influence in media, and just the same way that they've been able to squash a lot of very popular, progressive policy ideas, they've been able to pretty effectively squash, the sufficient drive from the public to do anything substantive to fix this. And it's just like, you don't hear much when you watch CNN and MSNBC about, could Biden just basically through executive order waive all medical fees? Probably. I mean, could Congress come together and do something on an emergent basis to cover everything, at least during the pandemic? And there's just been such little pressure put on lawmakers, and they've been able to get away with being called heroes for passing the most basic piecemeal things, or giving everybody little stimulus checks. I think it's just the public has not been coherent enough to put enough pressure on lawmakers to do anything about it.
Well, this is my question to the panel about that. I believe that was one of the first things that Trump said, that all medical coverage was going to be covered that was COVID related. And the LA Times that did a piece, in the summer of last year, I believe, going over several families that were getting hit with tens of thousands of dollars worth of medical debt because they had long COVID, actually something that you deal with. Dr. Eric, is long COVID, and these people had it.
Yep.
I wish I knew when that piece was. And if MT was here, moderator extraordinaire, MT would pull it up and find it and share it in the chat. So I'll try to find it and share it in a second.
Well,
But go ahead, Pascal.
There's a plethora of questions I would have, but one of the things that I find interesting, I don't know if you guys are aware of the case of Illinois, in which the Illinois state legislature is now stating that if you choose not to get the vaccine, that you should be responsible for all of your medical bills.
Yeah.
Dr. Eric and Qualia went into that. You're late, man.
I announced that. I thought that was kind of wild.
It's wild.
And The second thing that I wanted to talk about is how, contrary to what people believe, Medicare for All doesn't get rid of private insurance companies. And why do people believe that it does?
Ooh.
Yeah, it's true, and I have things to say about that. Like, as I'm personally on the side of like, I think we should probably also have the provider side should also, if not be privatized entirely, which, you know, I'm a communist, so I think eventually it should go that way. But I would like the provider side to at least have a public option. I think that has to happen. Because, you know, having done I was a regulator and I worked mostly with the insurance companies. I didn't deal with denying anybody care. That was not my job. But the fact that I worked with, you know, Medicare as it exists now, and extending that to everybody would be great. But I really think what we need is to get rid of insurance as much as possible, period, and just cut out the middleman, because it costs so much money. And if medical care is just free for everybody, there's no need for insurance.
I think it would be a mistake.
Really?
I think it would be a mistake to actually codify into the Medicare for All bill to basically outlaw private insurance. And you want to know why I think that? Not because I have any love for private insurance or because I want them to exist. Look at what our courts look like right now. Okay, so let's just say we get the makeup in the House and the Senate, and we get somebody in the White House that's willing to pass that and sign that bill. What's going to happen is that the courts are going to say it is unconstitutional to outlaw private insurance, and they're going to overturn it. And then because
Sorry, but if we provided healthcare directly to people through government clinics, would it be as required, if that makes sense?
I don't think
what I'm saying is
it wouldn't necessarily involve banning private insurance. It would just make it obsolete. Like you're paying directly through. Yeah, that's what I mean.
You want to make it obsolete. Some people were being critical of like not eliminating by law private insurance. I think that doing that would be a mistake, because they would challenge that and they would take it to the Supreme Court, and they would likely rule that it's unconstitutional to ban private insurance. And then because of separability, the whole bill would get struck down. I think if you put universalized Medicare in play, private insurance basically becomes obsolete, because no one, you know, the only caveat though is if you have private insurance in play, you're going to have wealthier people opt into that. And so the only way to do it is the way the UK does, where if you do choose to enroll in private health insurance, that does not absolve you of the requirement to pay into the tax system of Medicare, and it just becomes sort of like a little niche, you know, extra thing that some people enroll in, which is fine, because that ends up being very, very minuscule. But the whole like Buttigieg Medicare for all who want it, that's garbage, because that ultimately creates that's going to end up looking more like a South African system, when you have a complete two-tiered system where people who are younger, wealthier, healthier, and incur fewer costs all go into the private system, and you leave people with the least amount of money to pay into the system incurring the most cost, stuck into the public system, and then you can't reimburse. Doctors don't want to participate. So I do think it has to be written in a way where Medicare is dominant, and for anybody that does want to go into private, they still have to pay into Medicare. I think if you do it that way, that's probably the best way to do it.
I agree. I think that's the way it should go.
Yeah, but I mean, I think there's a really kind of problematic messaging that people are doing when we're talking about we want Medicare for all, and private insurance is a problem. It's like Medicare is completely private insurance. That's all. It's completely buttressed by private insurance companies.
Oh yeah.
Having everyone have Medicare does not remove private insurance companies. And if we're arguing that private insurance companies are what the obstacle is to cost control, then how exactly does Medicare for all with private insurance companies diminish costs if it doesn't neutralize them?
But would the panel agree that at this point, Medicare for all almost seems like sloganeering and a talking point to almost rally a base than it does an actual movement?
Yes. Yeah. I've always preferred, you know, I want medical care free at point of service. Like that's always what I have preferred to say, because Medicare for all, like, remember like how they just sort of went, well, Medicare for everybody who wants it. It can be co-opted very easily. Like, all they have to do is rename some bullshit neoliberal whatever and call it Medicare for all, and like, you got what you wanted, and it's just not at all what we wanted.
Your very long ass explanation, while making a lot of sense, does not fit well in a hashtag.
It's true.
It's true. You know, it's just medical care has to be decoupled from out-of-pocket costs. From people's personal finances has to be completely decoupled from healthcare. That's the bottom line. And the other thing is that, like, Medicare can deny things too. We get denials from Medicare. I'm sure you know that. So what happens if you have Medicare and Medicare denies your care? You get a bill from the doctor's office. You signed a piece of paper that said you are responsible for the cost of your care. You're getting a bill. That same bill can go to collections if you don't pay it. So
I thought we have a commenter who's like, I don't understand what Pascal means. I thought Medicare is government and healthcare. No, it's not.
It's not. No.
Everyone in America who has who has Medicare, senior citizens, disabled people, whatever, they have a private health insurance company that provides their health care.
Yep, and it's usually the same ones that you get through Obamacare. It's usually those same providers.
Yeah.
Yep.
Exactly.
And they're making money. They're making a lot of money.
Yeah, and like I say, I never dealt with individual denials. I enforced the contracts between the state and the medical providers, making sure that they didn't make, like, in their contracts, they're not supposed to make more than a certain amount of money. And I made sure they didn't make more than that certain amount of money. That was my only job.
Good.
But yeah, and yeah, I wouldn't have worked a job where I denied anybody healthcare. Like I couldn't have done that. But yeah, like, so it's all private health insurance. It's just paid for by taxes, and yeah.
With no cost controls. Well, there's some cost controls.
There are some.
There are some cost controls.
Yeah, and I dealt with that, but I'm going to be honest, like, whenever they were not happy with anything I did, they would call my boss, and then they would call a state legislator. And usually they would win that fight because they're just powerful. And honestly, I don't understand why people sort of bent over backwards to accommodate them, because I don't know, sometimes it feels like they have power because we've all decided they have power. You know, we've all just sort of agreed to that, and it's like, well, why is it we can't just say no? You know, you signed a contract, you're going to, yeah.
I think part of the problem, we talk about this on the show, you know, we have this theme that we talk about, the 50-year plus counter-revolution, and the theme is basically that since the rise of the post-civil rights era with Nixon onward, we've had this pivot to a form of capitalism that everyone knows infamously as neoliberalism, which is kind of this marketization, hyper-privatization. But one of the political consequences of moving to this kind of post oppositional politics, if you will, or post-protest movement era, or the new left, 60s, whatever you want to call it, is that we developed a consensus for an economic model that was rooted in providing less and less and less to American citizens, and more and more and more to private trading corporations on Wall Street.
Private
equity funds, you know, hedge funds, you know, all of these firms. And frankly, the only reason opposition to that movement came about is because the economy crashed in 2008.
Yep.
And which led to a series of other rippling effects, whether it be Occupy Wall Street, Bernie Sanders, so on and so forth, et cetera, et cetera. But one of the consequences of that kind of 50-year period is that I think people have lost, and Jason, I want you to chime in here because I like it. I don't think we know how to oppose the government anymore. I think that people have lost an understanding of how to actually make the government respond to the demands of people.
Well, you know what's interesting? So I did the show with Ashley Frawley this morning, and we talked about her book on happiness, the semiotics of happiness. And in that discussion, you know, we talk about how the wellness, the mindfulness industries, now the happiness industry. I didn't realize that was a government fucking position. There's a chief happiness officer.
Ew.
Yeah.
Creepy, right?
It's very 1984.
That's a real thing, right? There's a happiness index.
Mm-hmm.
And as we look at these problems, and I asked her, I said, is this the neoliberalization of emotion now? Like, are we trying to neoliberalize happiness? We look at our problems as not systemic problems, as us problems, especially in the workplace. And it's definitely a PMC thing, whether or not you want to, you know, you're going to have the Derek Varn there. There is no PMC, or the Catherine Liu PMC take. Regardless, it is kind of a bourgeois problem. If you work at Amazon, you're not going to have Wellness Wednesdays where you sit in the fucking decompression room and think about how shitty your day is. Right? It's just bitch work. But someone had asked a little while ago, like, well, how do we get this kind of cross-class collaboration with the PMC and the working class? And that show, and I don't know when exactly it's going to air, kind of got into the weeds on why that can't happen. And to your point, Pascal, it kind of got into the conversation, kind of got into the weeds on why people are kind of confused on how to deal with the crisis of institutions, or institutions in general, or government, because we're just so disconnected from how it all works, first and foremost, because it's always our fault. Like even these pop culture references we're using as movies, Saw and like John Q, the evil person is the doctors, the individual guy at the insurance company that turned him down, as if a different guy was sitting in that same seat, doesn't get turned down. So I'll bring up another pop culture reference, and we'll stay within the horror genre, as I was on the show with Ben Burgess and Teray Reed the other day, hasn't aired yet, and Teray brought up the movie Drag Me to Hell.
Nice.
And he's talking about kind of this neoliberal era. It's about to be the end of the Bush years. And if you remember, the whole movie centers around this woman who works at a bank, and a poor woman comes in who ends up being a gypsy, and she's trying to get a loan to save her house, and the woman has the power to grant the loan,
right? But she wants a promotion.
But she wants a promotion, and not just wants a promotion because she's greedy, but she comes from nothing, and that's the environment she's in. Kind of like the movie Office Space. Her coworker has 57 pieces of flair.
Right.
He'll make the shrewd move to get the promotion. Does she have an inner to make the shrewd move? So she makes the shrewd move. She denies the woman the loan. The woman, of course, loses her house, puts a curse on her, blah, 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 blah. But I still feel like we're still in that mindset to a certain degree.
Right.
So trying to understand how to navigate real government problems, i.e. healthcare, do you really think people can look beyond the individual, Pascal? When a lot of discourse is solved by, well, all politicians are bad. Two wings of the same.
I mean, I think that what the reality is, though, is that none of that is possible without a process of political education. Not to sound like a 1965 SNCC worker, 66 SNCC worker, actually. But like people are not going to know how to operationalize their politics to challenge the status quo unless you teach them, and part of that education has to be explaining the terms upon which the existing mechanisms of government function and why the existing terms of government functionality are not working for large segments of American society. Because part of the way in which our society is socialized is that when you are being victimized by the nature of American capitalism, for many people, the instinct is to blame themselves because the whole messaging around this system is that, what do you mean you're not a millionaire in America? What's wrong with you? This is the land of milk and honey. This is the land of the free and the home of the brave. Look at all of the opportunities that you have here. Look at all the people that are coming from all over the world to come to this country. And what are you complaining about? As if people don't realize that one of the things that capitalism requires is poverty. Or one of the things that capitalism requires is, economic exploitation in the form of labor extraction. One of the things that capitalism facilitates is diminishing value of labor and wages over time. So that
and healthcare not being a right heavily is built into that because people stay in jobs that they don't like and they're afraid to go out and do whether it's entrepreneurship or whatever else it might be because they need that private insurance plan and they will put up with lower wages and worse working conditions because they need that health insurance plan. And I think that is a tremendous tool of control in keeping people docile and behaved and not doing anything too bold and brazen because you lose that health insurance plan. If you have medical needs, you're toast. I mean, you're in big trouble. So I think that's a big part of, the equation as well.
Yeah, I think there's been a lot of things going on over the past 70 years, sort of intentional dismantling of the systems which taught people how to organize. There's been I don't think that I think fiction is probably a bad tool to teach anybody how to organize because most fiction, at least in the West, is a story about an individual and not necessarily about a system. And the fact of the matter is, as individuals, we can't change things. We can only change things as part of a movement. And so it's very hard to learn from fiction how to organize. We need to learn that from each other. I thought it was so interesting that there is sort of a chief happiness officer because, thinking about things as a communist and sort of an accountant, one of the major ways we alienate things is by turning them into a number. And it's just amazing to me that we've tried to turn happiness into a number. God, is there anything more neoliberal than that?
Right.
It's scary.
Yeah.
No, it's really there's a real. I mean, just and I say this all the time to our comrades and friends on the left, and maybe it's a product of me kind of growing up, like all of us who did prior to the rise of the current contemporary left, where we had socialists, communists, Marxists, anarchists, and all that stuff who were saying that publicly, is that people don't realize, and I think this is my opinion, you may disagree with me, having Americans, regular people saying capitalism is a problem, I think we really underestimate how much that is an anomaly in the consciousness of the American body politic and how much that gives us an organizing advantage when we find such a person. Instead of us focusing on how, they're not from our tendency or they are this kind of leftist, that kind of leftist. And I'm like, yo, the fact that you have, decent numbers of Americans saying that they like socialism. I'm like, do you guys, do people understand what this country was like 30 years ago? Do people understand the actual lack of socioeconomic options we've had in this country for almost 50 years? And the fact that, for me, that we have all of these burgeoning people, particularly younger folk, who are now starting to realize, largely because of the way in which the economy is failing them, that there's a problem with capitalism. the lack of capacity that we have to really organize to make an effective politics, to me, is not so much of an indictment of the left per se, and it might be, but it's more of a realization that this type of politics is so outside of the consciousness of so many Americans, and it has been for so long, that we really, I think, have to be more patient with each other in learning the process of how we operationalize our opposition to things and turn it into a system in which we can build upon something for all of the constituents that we care about, because there's too much of a tendency of us being, whether we're Marxists, Leninists, socialists, sock Dems, Trotskyists, anarchists, or socialists who are not Marxists, there's too much of a tendency for us who are left of the corporate Democrats, who understand that capitalism is a problem, to simply say it's not working because it has to change, because we have to tear it down, because the problems have all, because. And the question becomes, yeah, simply pointing out what the problems of a system are not curing the system. It just simply points out the problem. When are we going to come to the point where we actually are creating a remedy to the system? In other words, when are we talking about building something that makes a more humane society for people? And part of the problem and my frustration with our comrades on the left is I don't hear enough voices talking about that. I will always hear people talking about how the system cannot be reformed, it can only be torn down. I was like, yeah, that's a really great political slogan to appeal to normies who have been outside of any type of left politics. That the only thing, I mean, who are you talking to? Who exactly are you convincing with that kind of politics?
Yeah. Yeah. Well, absolutely.
You know, and it's just something for me. It's just like, we've got to, whatever your model is, capitalist, socialist, whatever. Like, you got to present the option.
Yeah, I think it's definitely much easier to critique than it is to build. I think, honestly, I think part of the problem is a lot of people have some solutions that they're worried they would get arrested for voicing, which is definitely, and that's not necessarily because you're doing something all that radical, like police will arrest you for just about anything. Honestly, it's a dangerous business, but yeah, we probably need to take the risk and start expressing some solutions.
I think it's actually necessary because I don't see us involved in a serious political project without an issue. Because I go through this kind of internal thing. Like, I have comrades, I've written for publications with people who are, they consider themselves revolutionary socialists, revolutionary Marxists, Marxist Leninists, and they're always like, reform is not an option. We need a revolution, blah, blah, blah. And I'm like, what does that mean? What does that look like exactly? And why are you assuming that revolution leads to liberation in any way? And why are you, so when you're saying that reform court can't happen, why exactly, like, so are you saying that in the process of you working towards a revolution, if you were offered reforms, would you reject them? Would you say, no, we don't want these reforms because we're only working towards revolution? Revolution is not a sandwich that you get at Jack in the Box.
I mean, I think really to have success, things have to be framed in a way when I think painting certain ideas as radical is kind of working against us, because ultimately, I mean, coming at it from my angle, which is like, how do I see the future of U.S. healthcare going? The idea of having universalized, whether single payer or just to simplify, the decoupling of health services from individual expenses healthcare for all free at the point of service. The problem is it's being painted as this radical idea that's going to radically depart us from the healthcare system that we know, and that scares suburban, normies, and it scares people who are just kind of like outliving their lives, maybe largely apolitical. And I think one of the important things to really drive home is that it's really our current trajectory that's going to radically change things in a way that we don't recognize. And moving to that, that universalized model is really the only hope we have of, I guess, preserving what, we recognize and like about, going to a clinician, whether it's a doctor, a healer, whoever it is. And if we travel down the further sort of neoliberalization of healthcare, and then building on the Affordable Care Act, and then building on the Affordable Care Act, what's going to keep happening is radical departures. I mean, the reality of navigating the healthcare system now, I would say, has changed for the worse. Of course, like, it's good we've expanded Medicaid and we've brought more people into the 10 who didn't have coverage, but the sort of the way that it's operationalized thing for a person like yourself, Qualia, trying to just like navigate U.S. healthcare, it's made things like suck. And I think, like, rather than painting this project as something, we're going to revolutionize, we're going to make this brand new system, it's like, no, we want to preserve what we actually recognize and like about being able to access healthcare. We want to give it to everybody. We want to avoid this complete deviation and departure and this just unrecognized mutant of a healthcare system we're going to be looking at in 10 years if we stay on the current path. I mean, I think when you frame it to people that way, you get them on board with it much more so than painting it as sort of more of like a revolutionary idea. And I don't know if you can extend that to other issues of sort of left politics, but I think a lot of the things that we're pushing for are things that are pretty non-controversial in the majority of like developed nations. And I think like the opposition to these things wants to paint them as revolutionary and as as extreme, when in reality, just about any other developed nation you go to, they're very uncontroversial, and even conservative parties wouldn't really try to take them away. And so, I'm much more of sort of a normie than most of the people that I deal with in this particular space. So I'd spend much more time talking to more apolitical people, and I find that it's much more successful when I'm framing things that way than trying to sort of push for like big radical change, which ultimately scares voters. And if you scare voters, you scare politicians.
Well, sometimes I wonder. Oh, I'm sorry, Qualia, go ahead.
Like, one thing I worry about is the basics of the basics are the moment the right wing gets a hold of them, the most milquetoast reform is suddenly dangerous commie socialism that's going to end America. So my personal point of view is always like, forget how you message it. Like, you don't have to call it revolutionary or anything. Like, when I talk about what I want is, I want medical care that is free at point of service. I want government clinics to help make that happen so that insurance doesn't come into it works. And I don't worry about calling it revolutionary. I don't worry about calling it this or that. I just say what it is I want. And I anticipate that the right is going to call me a communist. And I'm going to say, yeah, I'm a communist. And I'm an American and I'm a worker. And yeah, that's sort of how I address that.
Here. A super chat here from Strom McCallum, friend of the show. We need to identify ourselves with the amelioration of the everyday suffering of proletarians. Radical reforms won by socialists as steps towards socialism are necessary. I agree. I mean, one of the things I was going to say is that sometimes I want to ask, there are people who I see in our space, in our political space on the left, and I said, are you more interested in posturing radical or revolutionary, or are you more interested in solving people's problems? Because I believe that there are individuals who are like, I don't think that's a radical answer. Well, what if your radical answer doesn't solve people's problems? So what are we more interested in doing? We got to come up with the most radical answer. Do you want to come up with the most radical answer, or do you want to come up with the most effective way to solve the problems of society in a way that diminish exploitation as much as possible.
I think these are also the people that like to say that you're not radical enough, that like alienating people.
Mm-hmm.
And I don't think they
You know,
understand, or maybe they do understand, they just don't care. It's like, well, if you're not with me, then you're against me.
People like to create their own little kind of like, ideological clubs, and, like we're the cool kids, we're radical. I mean, my whole thing is that like posturing and fetishizing radicalism to me is kind of pedestrian in many ways, quite frankly. It's like, I got to prove I'm left, I'm radical. I'm like, one of the consequences for me is of having people who were radicals in my life, in my family, being around people who, did radical things, is that I realized that the people who actually did things that were actually truly radical didn't do them because they wanted to seem radical. They did those things because they were trying to solve people's problems.
Mm-hmm.
And I think one of the consequences I find with people, particularly in my generation, particularly those who were born after the movement period, is that they have this kind of fetishism for radicalism, this fetishism with militants of Black Power fists and Afro picks, and I'm like, you think that's politics? Like, is that really politics? Or are we trying to solve people's problems? Of course, in a way that minimizes and neutralizes exploitation. And my position is not that we should not, talk about revolution. What I'm saying is that revolution is not, a fish sandwich you're going to get 2 for $5 at McDonald's. Revolution is a serious process of social transformation that should be dealt with and taken seriously. But just don't, just the posturing is like, well, that's not revolutionary enough. Like, what are you talking about?
Mm.
Yeah, I don't know. Like, I find that when you talk to people in person, like leftists in person, there's a lot less posturing, usually because you're there to do something, and it doesn't matter if you're like usually, like I'm in Austin, and sometimes we've got a couple of people who like to pick fights down here. We've got a couple sects that like to pick fights, but for the most part, people online will fight, well, that's an anarchist. I can't work with them. I can work with anarchists. I can work with anybody who is there, to feed the homeless or change some brake lights or anything like that. Like that's all that matters at the end of the day.
When you're doing real work, who do you think you're working with? I love the fact that people that are like ridiculously online think that when you're out there in the streets doing outreach work, that it's you and a bunch of hammer and sickle shirt wearing people that are, as you're fixing brake lights or helping people get services, you're waxing poetic about the Cuban Revolution. Sadly, that's usually not the case.
Right.
Can you guys hear me?
We're working at a free clinic, giving people free care.
You're going to be working with a lot of, at best, liberals. Eric, would you agree?
Definitely. Yeah, of course. Yeah.
So, alienating language sometimes doesn't help the bigger project, depending on what it is you're really trying to do. When you talk to activists, as we've had activists on this show talking about, various laws they've gotten passed. Pascal, remember the show we did with Luke Mayville?
Absolutely.
Organizing in red states in the rural parts of Idaho to get legislation passed when it came to schools. What was the other legislation that got passed? It was a voting rights thing. Can't remember off the top of my head. But you have to work with people that don't share your ideological beliefs.
Right. Yeah.
How do you... So that's my 2 cents.
I can dig it.
Well, we've been going on for too long, and it's late where everyone is except for me.
Well,
I really,
Thank you.
again, guys, I
Say
apologize
again?
for coming on late because I had an obligation earlier, but I really enjoyed the brief amount of time we had to talk. And I know you guys have
Definitely.
been on before, but would love to set up a different time for us to really hash through this because the healthcare debate ain't going anywhere anytime soon.
Yeah, I'll come. I'll talk about healthcare anytime. I always appreciate the opportunity to do that.
Yeah. It's been a pleasure. Good to meet you.
Thank you so much.
Thank you, guys. Thank you, Dr. Eric. Thank you, Qualia. Thank you, chat. We will be back Saturday with veteran Mike Kim. We're going to talk veteran affairs and people of color. And then we will be premiering, after that, our sports show. Dun, dun, dun. Because we surrender nothing to the right, we're taking over the world of sports, much like we've taken over the world of film review and tabletop gaming.
Nice. All three of you guys, please keep up the good work. Jason, Pascal, and Qualia, you guys all keep up the good work.
You too.
Thank you so much, Doctor.
Eric, we have no choice.
Right.
I'll keep an eye out for the tabletop RPG stuff because I'm into that.
The third Wednesday of every month, we do a show with Derek Varn and Jean Bajlan. It's called Gaming Materialists.
Oh, cool.
We talk labor movements within the gaming industry, the gaming industry in general.
I'll be sure to check it out.
You better, because I know you know all about gaming. And maybe Jean and Derek will have you on. We could do some cross-streaming stuff. This is how we build. Again, leave nothing to the right. We will take this shit over.
That's right.
One podcast at a time. All right. Enjoy the capitalist realism of my youth.